Each second of every day, 4 new babies are born. But 32 of every 1,000 babies born in the world will not survive their first year. In Australia, this number is much smaller, only 3.4 per 1,000. But in Kenya, 39 of every 1,000 infants will not survive their first year of life. What causes this huge difference? Let's have a look at a potential contributor, the prenatal care received by women in both of these countries. Let's say Olivia was born in Australia and Faith in Kenya, both 20 years ago. Just recently, they've shared what most of us know to be a turning point in a woman's life. They have missed a period. So, how do they respond?
In Australia, Olivia acts immediately, having learned what a missed period probably means. She leaves her home in the suburbs of Melbourne to buy a home pregnancy test, reads the package and finds out she has to wait for 7 to 10 days to let her hormone levels increase. Eventually, she takes the test, and yes, indeed, she is pregnant. Olivia visits her family doctor, who supplies several vaccinations, takes her blood to test for, among other things, her iron levels and rhesus factor. Also, she gets a physical examination, in which Olivia's weight, height, blood pressure, and more are measured. At 9 weeks pregnancy, Olivia visits her doctor for a second blood test, to screen for problems and potential risks in her pregnancy. At the 11th week of pregnancy, an ultrasound is performed to visualize the embryo's development. If the blood samples and ultrasounds reveal, for instance, a malformed embryo or too little amniotic fluid, they will either diagnose and discuss the problem or do further testing, such as direct sampling of placental or amniotic fluid. After she's seen the baby on the ultrasound, Olivia starts getting her house ready for him. Furthermore, she starts going to antenatal classes. Around the 23rd week of pregnancy, Olivia has been screened for renal disorders, sexually transmitted diseases, and she has found that the fetus, the weight of which she starts to feel, does not have trisomy 21. She has visited her local clinic 5 times already.
Starting from the 23rd week, Faith in Kenya gets ready for her first visit. She has put on weight, she has not had her period for months, she can feel movement in her belly, she knows she's pregnant. After an hour-long trip, she gets to the closest clinic, where a physician performs a physical basic exam, where the physician also listens to the fetus's heartbeat with a pioneer horn. He takes a sample of urine and vaccinates Faith for tetanus toxoid. Faith also gets tested for AIDS and malaria. She leaves the clinic with some advice, such as drinking a lot of water, taking vitamins and folic acid complements. And she's also advised to do a chromosomal or genetic disorder testing, which she will not do because it's really expensive and abortion is not legal anyways.
As birth approaches, Olivia visits her clinic more and more.
Whereas in Kenya, only 58% of women visit the clinic at least 4 times.
Let's look at a bigger picture. Both the Kenyan and Australian governments offer a basic prenatal package for their expectant mothers.
Olivia is aware of it, and she also makes use of it.
Whereas in Kenya, most women do not use it because they just don't know about it.
Also, availability is a meaningful determinant for the amount of care a woman receives. When Olivia and Faith missed their periods,
Olivia easily buys a home pregnancy test in a shop nearby.
Whereas Faith does not have that possibility.
In an ideal world, every pregnant woman would have access to quality prenatal care. The current differences between Australia and Kenya are vast in terms of educational standards, universal access to prenatal care, including screening and diagnostics, and number of available healthcare professionals and clinics. There's hope for the future, though. In the last just over 50 years, Kenya has reduced their infant mortality rate from 119 per 1,000 down to 39. Maybe Olivia and Faith's grandchildren will have equal prenatal care. Thank you.